And luckily, today we are connected with Dr. Habibie Arifianto, SPJK, MCAS FIHA, a cardiovascular imaging consultant and a heart failure physician at the UNS Hospital, to explain more about this broken heart syndrome. Good morning, Dr. Habibie. Thank you so much for joining us this morning right here on the C Morning Show.
Good morning, Carol. Good morning, Evie.
Good morning, Doc. It is such a pleasure to have you today as we will and digest about the broken heart system. So for the first question, Dr. Habibie, could you explain more about the broken heart system and elaborate more about the Takotsubo cardiomyopathy, or known as the broken heart syndrome?
To say Takotsubo cardiomyopathy, because it was founded in Japan. The Japanese cardiologist found people with acute stress can form a heart failure symptom. Takotsubo cardiomyopathy, or a broken heart syndrome, is a transient form of a heart failure that characterized by the formation of a heart anatomy that formed into a Japanese ancient octopus trap, or Takotsubo. And this disease can cause heart muscle weakness or dysfunction that can make heart fail to do their job as a pump. So the circulation cannot well develop in the patient with heart failure, stress heart failure, like Takotsubo cardiomyopathy.
Right. Doctor, this is very interesting. A lot of people say this, when you have stress, it's just in your head. A lot of people say that it's just in your head. So can you explain how something that's just in your head can affect you physically and even be fatal?
Yeah. The stress came from your physical or psychological mind, but the effect of the stress can be widened along of all our body system. The stress can cause increase of the stress hormone, or we call it catecholamine. If the catecholamine overflow in our body, that can make the blood vessel spasms, and also the water more retention, and also increasing heart rate, increasing cardiac workload. That makes the heart more and more vulnerable to have pressure overload, and also volume overload. So the heart cannot pump well during the stress condition.
Yeah. So Dr. Habibie, what are the symptoms that you can feel, or that you can see that you are having the broken heart syndrome?
The symptom is just like ordinary heart failure symptoms.
Right.
The patient sometimes feels chest discomfort. The patient sometimes feels dyspnea or shortness of breath. They cannot walk in a long distance without having a difficulty in breathness. Then easily fatigue, and also feel bloated. And for exclusively for the heart failure, stress cardiomyopathy, the patient usually feel depressed because of the psychological stress they encounter.
Wow. So psychological stress
Exactly.
Can lead to something very serious, isn't it, Doc? So here's my question.
Yeah.
Is one gender more susceptible to broken heart syndrome, and what kind of stress triggers it the most? Is it maybe a relationship, a love affair, or maybe it's something more like personal bankruptcy maybe? Which kinds of stress are more susceptible?
Yeah. Women are more susceptible, and most of the Takotsubo cardiomyopathy patient is 50 years old until 75 years old. It's around 60% of all Takotsubo cardiomyopathy. But below 50 years old, it's only 10 until 11%. So mostly on the perimenopausal periods of the woman, and also a geriatric patient. And every psychological stress and every physiological stress can lead into Takotsubo cardiomyopathy. Most of them are griefs. Someone dead, someone she loves dead, can lead into a very stressful condition, domestic violence. socio-economical factors, bankruptcy, like what we say. And there was a case report during this COVID pandemic. The COVID sometimes can lead into stress cardiomyopathy because of the physical stress that a body encountered from the coronavirus infection.
Right.
Wow.
Now, this is I'm very curious about this one, Doc, because you were saying before that women, this broken heart syndrome is more prone to women, especially those that is hitting the menopause situation or that on the statement itself. Is it only for those, age 50 above because they're hitting their menopause stage, or does it also prone to younger women because we have hormonal imbalances also, especially to the younger female that's maybe undergoing to some, like you said, relationship issues and peer pressure, especially where we're living right now in the pandemic era. Could that lead on to younger age, female with a younger age, Doc?
Yeah, according to the case report, there's only around 10 to 11% female younger than 50 years old that affected with the Takotsubo cardiomyopathy. So don't worry.
Right. So you're healthy enough for you to, compensate with your problems.
That's right.
Because some papers say, some research journals say that the reproductive woman still have a hormone we call estrogen. Estrogen is very cardioprotective hormone, so don't be worried.
Right. So that's the medical explanation why the younger is more capable to not getting the broken heart syndrome.
That's right. Doc, so how is broken heart syndrome different to a typical heart disease or a heart problem? Or is that also a trigger to a heart problem?
Yeah. We know that the stress can lead into a different perspective of the heart disease. Yeah, that was a heart attack. We can commonly what heard about the heart attack. Heart attack is a different etiology. Heart attack usually comes in patient with a coronary artery disease pre-existing. But the stress cardiomyopathy, usually the patient doesn't have any risk factor of the heart disease, only some acute and severe stress that can make he or she more prone to have stress cardiomyopathy.
All right. So is this broken heart syndrome, can you inherit it from, let's say, your parents or grandparents, or this is not an inheritance of heart disease, Doc?
It's hard to explain, because we didn't see any any genetic factors on this kinds of disease.
All right, Doc. Let's talk about the treatment we can get with broken heart syndrome. How do we diagnose it, and what kind of treatment can we get to prevent this?
Yeah. Diagnosis usually comes from the good anamnesis, good interview. The patient have a history of the very psychological disturbance in recent times. Then we can do some echocardiography or heart ultrasound to see the anatomical diagnostic with Takotsubo shaped heart, or using a cardiac MRI. And then for the treatment, the European Society of Cardiology guidelines, also the American College of Cardiology guidelines, also our local guidelines, Indonesian Society of Heart Failure, is having 4 obligatory drugs to treat every kinds of heart failure, including stress-induced cardiomyopathy or Takotsubo cardiomyopathy. And also, we can use diuretics to improve urination to reduce the volume overload on the patient with stress cardiomyopathy.
All right. So those are, how you can, treat yourself if you receive it. But how can we avoid it, Dr. Habibie? How can we avoid the broken heart syndrome? Hence, especially we're now living in an era with COVID-19. A lot of people are sad. A lot of people are in high, intense stress. How can we avoid this syndrome?
Yeah, the best option to avoid the stress cardiomyopathy is the positive thinking every time.
Right.
Yeah, positive thinking. Then we can share our griefs, we can share our problems with our close friends. Yeah, and also if we have a friends that have a problems, try to give a solution. Try to give a solution. Try to give support so the stress we can cope easily.
All right. Okay, Doc. So I understand that the diagnosis, of course, the best comes from the doctor for a broken heart syndrome. But say we know somebody, a friend or a family that we think might have that problem, but is afraid to get a treatment for it or even to get checked of it. What signs should we look for, to figure out, oh, maybe he or she has a broken heart syndrome that needs help? How do we
For the first
understand
emergency
that?
response too, right?
That's right.
Yeah, if you see someone have a great psychological stress and the patient have a symptom of breathlessness, yeah, deep slow breathlessness. Also, if you check her pulse, have a tachycardia pulse, yeah, it's more than 100 beats per minute, the
All right.
heartbeat, and you can ask she or he to come to the cardiologist to check whether the patient have stress cardiomyopathy or not. Why it's important to have an early diagnostic, early intervention in stress cardiomyopathy? Because stress cardiomyopathy is a disease that is very transient. If we have a good medication during the early phase, 2 weeks, most of them are 1 month, the patient can get a normal function heart.
Right.
Okay. So that is good to know that if you have the earlier diagnostic that you can at least, encounter and be out of it, end of the broken heart syndrome. Thank you very much, Dr. Habibie, for your time. We're very sorry we're out of time with this discussion. But we'll see, I will for sure see more of you right here on the C Morning Show. Have a great Monday, doctor.
Have a good day, Doc.